Namaste everyone. My name is Dr. Suresh from eGlobalDoctors, and I head the Department of Holistic Nutrition program. So as you all know, eGlobalDoctors is a telemedicine and telehealth platform from doctors from US, UK, Europe, Australia, Middle East, and also from India. So you have the options of having consultation from doctors in US, and you also can go for second opinion or specialist consultation from any of the country of your choice. And we have more than 400 doctors signed up with us, available in all specialties. And also we offer holistic nutrition and disease reversal programs. Okay, so as I said, I head the Department of Nutrition, and we have holistic nutrition coaches. And today's topic, as you all might be knowing, that why diet plans are a passe. That means why they are not in vogue, or why they have become redundant. Did they actually become redundant, and what is the problem with diet plans? And what is the difference between having a diet plan and having a dietitian or a nutrition coach for yourself? So if we look at the chronic lifestyle diseases that people are suffering with these days, you name like diabetes, hypertension, and in US especially coronary artery diseases, heart attacks, sudden cardiac arrests, and the trend is now being seen even in India. Young adults, people in their early 40s and late 30s, they're also succumbing to these lifestyle diseases. And when it comes to women, whether it is young children like like teenage girls suffering with PCOD, and newly married couples suffering with PCOD and infertility, and middle-aged women suffering with hypothyroidism, obesity, all these conditions, they are called chronic lifestyle diseases. And as a practice, we all know that when we go to a specialist, they always advise you to go to the dietitian, in-house dietitian, and get your diet sorted out. But the problem is the diet plans that the dietitians give, the clinical dietitian that you receive from a clinical dietitian, they have been around for so many years. Okay, if diet plans were the solution for these chronic conditions, people would have been living without these conditions by now. But why they are not working? Here is the fundamental difference. Between a diet plan and a therapy plan. Diet plan, we call it as like nutrition therapy, medical nutrition therapy, and medical plan is like pharmacotherapy, that the doctor or your specialist prescribes those medicines. It is called pharmacotherapy. And pharmacotherapy is totally different from medical nutrition therapy. This fundamental difference, many people fail to acknowledge and appreciate. The difference being here is, if a doctor gives you a prescription where you have prescribed a drug consists of a single or two active molecules, okay, pharmacological preparations containing either one or two, or in some cases three active molecules that work on your body. Okay, and nobody will deny a specialist or a consultant or a doctor when they were prescribed these medicines. People, there is more than up to 100%, near 100% complacency, compliance when it comes to pharmacotherapy. But when it comes to medical nutrition therapy, in the same way, if you are given a diet plan to be followed for next 1 month or 2 months, or in some of the cases, lifetime, people's compliance with diet plan is very, very low. In some of the studies, these nutrition and lifestyle interventions, these studies are, they go way back, some 20, 30 years back. They did these studies and they say that, okay, they are successful only in 4 to 6% of the cases. Now, the question is it the fault of the diet plan or the dietitian, or the entire process involved while prescribing the diet plan? So I've been practicing nutritional medicine for 18 years now. And after completing my medicine, it's my 20 years of practice this year, 2022. And in 18 years of my practice as a dietitian, as a nutrition coach, what I observed is it is not the diet plan that works, but it is the dietitian. Because if you are a rice eater And if you come southern part of India or eastern part of India or UP, where the rice, I mean, like especially in West Bengal and in some parts of Orissa and most of the South Indians, they love their rice. And if a person is diagnosed with diabetes, you need not shift from rice to chapati, which was the practice. People were asked to eliminate rice totally. So, which is very difficult. I mean, a person is born and lived on rice for 30, 40, 50 years. Suddenly, changing that habit is a difficult task. They may comply for a couple of days or couple of weeks. And people who have strong will, they may follow it for 2 to 3 months, or maximum very disciplined people, they can follow it for 1 year, but they cannot live that on that change in their eating habits. So this is where the fundamental difference between pharmacotherapy and medical nutrition therapy comes in. When a dietitian is prescribing you a diet or giving you changes in their diet program, what essentially they are doing is changing their habits. And we all know the saying that old habits die hard. And if you lived with certain eating habits, and eating is an emotional thing for most of us, any festival we celebrate it with food, and everyone is emotionally connected to the kind of food or the kind of cuisine they have lived with or have grown up with. So this change in their dietary behavior is not achieved by getting a diet plan. So I always discourage people when they ask me for a diet plan. I simply say that, okay, I can give you a diet plan, but end of the day, to be honest, it is totally useless. Diet plans, they don't work. And we have seen many number of diet plans. People come up with like GM diet, Atkins diet, South Beach diet, fruit diet, liquid diet, whatnot, the Mediterranean diet. There are so many diets. I mean, if you go to Wikipedia, you'll find more than 165 or close to 180 diet plans that were in vogue. So none of them are effective because the same size doesn't fit everyone or doesn't fit all. So we know that. So it has to be customized, and we are working on changing the habits of the individuals. So it takes certain time. So unlike a visit to a specialist or a consultant doctor, uh, for you to work, for your diet plan to work, you need to be put under a program. At least start with 3 weeks, or I mean, like a minimum of 3 months. That will give you the time to adapt to these new habits. You don't have to change. I mean, one cannot change their dietary behavior overnight. It has to go in a step-by-step wise manner, uh, step-by-step manner, or step-by-step wise. So this is what gives you the result. Let me give you an example. Say, we know that in certain cases of hypertension, uncontrolled hypertension and uncontrolled diabetes, uh, people end up having this kidney disease. And if the kidney goes into failure, what is failure? The kidney is supposed to filter out all the toxins from the body and keep the blood pure. That is the job of kidney. If kidney is failed to do that job or is incapable of doing that job, it is called kidney failure. And there are different stages, 1, 2, 3, 4, 5 stages of kidney failure. And in the end stage renal disease or renal failure, people usually opt for either transplantation or some other solutions. I mean, usually it is transplantation. So there was one prospective study on chronic renal failure cases. I mean, like it was a very exhaustive study, more than a decade long, in Norway or somewhere. I mean, they did a study, and they have come up with a conclusion, almost like it happened 2 decades back, I suppose. And they have come to a conclusion: once the patient starts on a journey of liver failure, it is always progressive, you cannot come back. But let me give you what a nutrition coach, right, did to this study. I mean, though it is an anecdotal, but given a chance, I mean, like we would like to explore more and more cases. Let me tell you this case where the person lives in US, and I mean, like an adult in late 40s, and this guy is very well educated and runs a huge business, and he was diagnosed having chronic renal failure because of uncontrolled hypertension. and his kidney is unable to eliminate those toxins. And according to the study, according to the literature that is available, so the consultant nephrologist was doing all he can. But when the patient approached one of our coaches in eGlobal, so what she did was she took the complete history and the onset of disease, why did it has come and for how long it has progressed, and the stage of complication that the patient is facing, and all the symptoms and everything, looking at the diagnostic parameters, which took some time. And she is able to bring that patient from stage 4 to stage 2. Okay, all this has happened in a span of weeks. So 8 to 10 weeks, and the patient is quite happy, and the consultant nephrologist is also happy, is able to bring down that medication, dependency on medication. Now his pressures are maintained normally. And all this has happened because the patient choose to travel with a nutrition coach. The dietitians, we call them as coaches, because when we are talking about habits, it needs certain amount of training. So it has to be like we start with few habits initially, and once they are like established and the patient is able to sustain, we add few more changes to their lifestyle, their eating habits, their fitness habits, and all these things, they go a long way in achieving this. Not only this renal failure, I mean, like there are so many hundreds of cases where we as coaches, I mean, like in eGlobal, we have 30 plus coaches listed in our website. You can go and watch out our homepage on nutrition. So we have solutions for all different conditions, whether it is PCOS, hypothyroidism, menopause, diabetes, hypertension, heart disease, cholesterol, you name it, arthritis, rheumatoid arthritis, any other kinds of autoimmune disorders like psoriasis. So we have more than 30 plus holistic coaches listed in eGlobal. What we are offering here is this coaching program. So as a principle, we at eGlobal, we don't encourage you to go with diet plans. As I said, diet plans, they don't give you 100% result. And what you require is not a diet plan, but a diet coaching program or nutrition coaching program. And that too, we look at in a 360 degrees view. So not only, as I said, not only this renal failure, we have certain cases. I mean, you don't have to visit the coach in person. And since we can all use well versed with technology wherever you are. So let me tell you one example. One of our coach is in Bangalore, and she was handling a case of type 1 diabetes. And this girl belongs to the Nilgiri Hill Range, a tribal community where they don't have access, and the patient also, a young kid, even though she is 15 years old, not able to attain puberty, not putting on weight, and the insulin dosage is increasing day by day. And I mean, like quite pathetic situation. So this coach traveled with that girl for almost like 3 to 6 months of time, and she is able to help the girl not only increase in weight, but finally she is able to attain her puberty, has got her first periods. So similarly, these kind of things can be done. So the bottom line I would like to share with all of you is that diet plans are a passe. Okay, if someone is giving you a simple diet plan, okay, this is going to work for you, it is not. It has to be a coaching program which we are offering at eGlobal. And I request all of you, if you have your family members or you yourself or your kids are facing any kind of chronic health conditions, whether it is IBS or PCOS, any kind of chronic health conditions, we are here to help you. Thank you very much for joining us in this program, and we'll catch up with you next time. Thank you.